everyone. Thanks for joining me for our fourth LDNdoctor.com webinar. Due to such a positive response from our last few webinars, we decided to hold another one with a detailed look at the benefits of using LDN for a specific condition. Today, we will be talking about rheumatoid arthritis, or RA. For those of you who don't know me, I'm Dr. Handler from LDNdoctor.com. At LDNdoctor, I use LDN for a variety of issues, some of which are hypothyroidism, inflammatory bowel disease, MS, depression, anxiety, chronic fatigue, autism, fibromyalgia, and of course, rheumatoid arthritis. So let's first start off with a deeper look into what rheumatoid arthritis is. Rheumatoid arthritis is an autoimmune disease where the body's immune system mistakenly attacks the synovium, a thin membrane that lines the joints. It causes chronic inflammation that leads to pain, swelling, and stiffness. Over time, RA can damage bones and joints, leading to disability. RA usually affects joints on both sides of the body equally: wrists, fingers, knees, feet, and ankles, as well as elbows, are most often affected. RA can also affect other organs, and people who have RA are at higher risk for other diseases, including heart disease, diabetes, and osteoporosis. So what are the symptoms of RA? Symptoms of RA may include one or more of the following: difficulty moving joints, stiffness and pain in affected joints, especially after sleeping, fever, red puffy hands, fatigue, hard bumps called rheumatoid nodules just under the skin near the joints, loss of appetite. And what are the risk factors? Age. RA occurs at all ages, but it generally starts in young adulthood, usually between ages 25 to 55. Gender. Women get RA 2.5 more times than men and are more likely to have severe symptoms. Family history. Having relatives with RA increases your risk of getting it yourself. Cigarette smoking. Smoking seems to increase your risk of getting RA. Obesity. People who are overweight or obese are more likely to have RA. The diagnosis of RA is made on blood tests or a joint fluid analysis, which tests the fluid in your joints for other possible causes of your pain. X-rays can also help make the diagnosis. Now let's talk about treatment. How is RA treated? Medicines you can buy without a prescription can reduce inflammation, such as aspirin, ibuprofen, or naproxen, and these medicines can help you feel better. Your doctor can also prescribe medicine for you, such as prescription pain relievers or prescription non-steroidal anti-inflammatory drugs called NSAIDs. These medicines also help you feel better and reduce pain and swelling, but none of these medicines slow the damage to your joints. They are harsh on the stomach, and they should be used wisely as they have other side effects. You only need to use the amount of these medications that makes you feel well enough to keep moving. Using too much medicine may increase the risk of the side effects. Medicine that manage your immune system are called immunosuppressants and can also be used to fight RA. However, these medicines can lower your immune system's response to infections. If you have only a few sore joints, your doctor may prescribe steroids, such as prednisone. Steroids also reduce pain and swelling, and steroids can slow the damage to your joints, but they can only be used for a little while. The longer steroids are used, many months or years, the less effective they become. They also have a lot of side effects, such as easy bruising, bone thinning, cataracts, and diabetes. Anti-rheumatic medicines can also help fight RA. If these medicines are started early enough, they can slow the damage to your joints. These medicines work slowly, and it can take a few weeks to start feeling better, but these also have a lot of side effects. Your doctor may do a blood test to make sure these medicines are safe for you. Surgery may be an option for cases of RA that are not treated with medicine. Talk to your doctor about all of the possible treatment options for RA. Now let's talk about LDN, or low-dose naltrexone. LDN is an effective medication used for RA without any harsh side effects. In fact, the most commonly reported side effect, vivid dreams and/or insomnia, usually resolves within a couple days. LDN works by binding to opioid receptors for a short time and thereby stimulating the body's production of endorphins. Endorphins have a healing property and an anti-inflammatory effect on the body. Many patients successfully stop anti-rheumatic drugs and steroids once they start using LDN. They feel more energetic, and the pain and inflammation often resolves completely. Now, what else can you do to care for yourself if you have RA? For anyone with a chronic illness, eating a healthy diet high in antioxidant-rich foods, such as fruits and vegetables, is essential. Eating a poor diet can increase inflammation in the body. People with RA are at higher risk of developing heart disease and diabetes. A healthy diet and regular exercise can lower that risk. Although diet cannot cure RA, studies show that people with RA report less pain, stiffness, and fatigue when they switched from a typical Western diet to a Mediterranean diet that is high in fruits, vegetables, beans, seeds, nuts, fish, and olive oil. Other studies link a vegan diet with lots of uncooked berries, fruits, vegetables, nuts, and seeds with reduced RA symptoms. Vegan diets contain no animal products and get protein from vegetable sources. These general nutritional tips can help you eat a healthy diet. First, avoid refined foods, such as white bread, pasta, and sugar. Next, eat fewer red meat and more lean meat and cold water fish. Next, use healthy oils such as olive oil and coconut oil. Reduce or eliminate trans fatty acids and avoid caffeine and other stimulants such as alcohol and tobacco. Also, drink 6 to 8 glasses of filtered water daily. It is also very important to exercise and is generally recommended to exercise 30 minutes daily for 5 days a week. The following supplements may also help relieve inflammation and pain. Omega-3 fatty acids, such as fish oil. Omega-3 fatty acids may help reduce inflammation. A review of studies where people with RA took omega-3 fatty acids found they had fewer tender joints, but no difference in joint damage. In some studies, people who took omega-3s were able to reduce their dose of NSAIDs or corticosteroids, which they took for RA. Omega-3 fatty acids may also reduce the risk of heart disease, which is higher in people with RA. Bromelain and serrapeptase. These enzymes may help reduce inflammation and pain. Turmeric is sometimes combined with bromelain because it makes the effects of bromelain stronger. Gamma-linolenic acid, also known as GLA, found in borage oil, evening primrose oil, and black currant seed oil, may help reduce pain, stiffness, and swelling. One study found that people with RA who took 2.8 grams of GLA for 6 months reduce pain and swelling, and improve their grip strength. Turmeric, as I already mentioned, also known as curcumin, may help reduce pain and inflammation. It is sometimes combined with bromelain because it makes the effects of bromelain stronger. Turmeric is also better absorbed with black pepper extract, so look for brands that offer a combination of the two. And capsaicin, Apply to the skin topically. Capsaicin is the main component in hot chili peppers, also known as cayenne. Applied to the skin, it may temporarily reduce amounts of a substance called substance P, a chemical that contributes to inflammation and pain in arthritis. Pain reduction generally starts 3 to 7 days after applying the capsaicin cream to the skin. Make sure to wash your hands with vinegar after use and avoid touching the eyes. Now, let's discuss LDN in more detail by answering our questions. Through LDNdoctor.com, I see many RA patients, and I provide them with prescriptions for LDN, which, as I already mentioned, is a very effective therapy for RA. We received some great questions about LDN for RA. Number 1, Nadine asks, does LDN help with extreme fatigue associated with this disease? Yes, Nadine. In fact, it is so helpful for fatigue that I also prescribe LDN for many patients with chronic fatigue and fatigue related to other diseases. Ray's question is, usually there's a direct correlation between body weight and drug dosage and effectiveness, or at least that's what it seems. Why is it not that way with LDN? LDN is different than other medications in that its dosage is more dependent on metabolic rate. For example, I often prescribe LDN for patients with hypothyroidism who often suffer from a slow metabolic rate. For these patients, LDN is often more effective at lower doses, even if the patient is significantly overweight. My approach is to first provide a prescription for a lower dose and have my patients move up slowly until they find the right fit. Then I offer a refill for the dose that works for them. Question number 3 is from Chris. I am new to RA, but I'm having a lot of issues walking. How will this medicine help me? Chris, LDN helps balance the immune system, so it actually helps slow the progression of the disease and also slow or even stop joint damage. It is also anti-inflammatory, so it is effective in reducing pain and swelling, and therefore ultimately can help you walk better. The 4th question is from Tatya. I have a question about supplements. Taking supplements with LDN. I've been taking LDN at 4.5 milligrams a day for close to 3 months now. I am still having swelling in my joints, especially my hands. Is there something I can safely take for the inflammation and pain until LDN is helping me more? I'm not discouraged. I've had RA for 27 years, and I know it will take time to see the full benefits of LDN in my case. Good, Tatya. I'm glad that you're staying committed to LDN, because in patients who have had the disease a long time, it can take months to start feeling better and to start seeing the benefit. One very important tip I have for you is to make sure that you're optimizing your vitamin D intake, as we have found that a vitamin D level of 50 to 60 on blood work improves the efficacy of LDN. Also, make sure you are avoiding supplements with calcium carbonate, as that can affect absorption of LDN. I also advise taking turmeric with black pepper extract, as well as omega-3. Both have an anti-inflammatory effect. The 5th question is from Derek, who wrote a lot of great questions. Derek writes, since starting LDN 3 months ago, my anti-CCP levels have increased from an already massive 1,640 to an even higher 1,840. While I know it can take LDN a while to do its thing, should I be concerned that this number has actually increased, even though it's apparently not completely indicative of inflammation levels? First of all, a comment on anti-CCP antibodies. Derek, the utility of retesting anti-CCP antibodies later in disease remains unclear. Most studies addressing the prognostic role of anti-CCP antibodies have relied on baseline testing alone, and evidence regarding the value of repeated testing is lacking. In fact, the current recommendations are not to retest anti-CCP antibodies. In patients with RA, one study found no correlation between changes in anti-CCP levels and changes in clinical indices, whereas in another, increasing anti-CCP titers were associated with greater radiographic progression. So I recommend placing more emphasis on your clinical presentation. If your current LDN dose or type is not working to relieve your symptoms, I recommend you make an appointment with me or another doctor that is knowledgeable with LDN to investigate why. Perhaps you need a different form of LDN, a liquid or a tablet that is free of fillers or binders. Perhaps your dose is not the correct dose for you. Derek also had another great question. What is the best way to determine what the right dose of LDN is, especially for those of us who notice no difference whether we take 1.5 milligram or 4.5 milligram? I'm currently taking 1.5 milligram and am dreaming more. Well, Derek, I recommend that you stay at this dose for a few weeks and keep a journal of your symptoms and work on the other diet and lifestyle modifications that I mentioned above. If you smoke, stop smoking. If you are overweight, work on improving diet and start to exercise daily. And again, very important, get your vitamin D levels checked. The seventh question is also from Derek. For those of us who are anti-CCP positive yet negative for rheumatoid factor, what is the best way to know if LDN is working or not? Just by pain relief? Yes. I would recommend basing improvement on clinical outcomes if there are not enough changes in lab values. Although, for many of my patients, their CRP, ESR, and RF start to decrease and trend down with LDN use. The eighth question is, are there any specific ailments someone can have that would prevent or slow the effectiveness of LDN? For example, some folks in the LDN group on Facebook mentioned that it wasn't until they cured their candida or Lyme that the LDN had a chance to work. And if so, what is the best route to take? There is no evidence for this. In fact, there are now gastroenterologists recommending LDN for candida and SIBO, small intestinal bacterial overgrowth. The ninth question. Some people mention having success with LDN only after switching compounding pharmacies and or changing from powder to tablet or liquid. For example, what is your take on this? Should someone like myself who isn't experiencing any relief after a few months on LDN consider switching to a liquid or switching pharmacies? So it's hard for me to answer this question. I need to know more about you and about the form of LDN you are using. My staff has investigated the top compounding pharmacies for LDN in the country, so I am very confident in the pharmacies that we use. We check to make sure they have no fillers or binders or only use fillers that we approve of. Thank you to everyone who sent in their questions, and thanks to all of you who are watching. You can always visit www.LDNdoctor.com and look at the FAQ page and on LDN Doctor's Facebook page. To hear about future events and other LDN Doctor news, like our LDN Doctor Facebook page and subscribe to our YouTube channel. If you or anyone you know are interested in starting LDN or need to refill a prescription, we would be happy to help. Just go to www.LDNdoctor.com and schedule an appointment. Enjoy the rest of your day.